Today the ballot opens for the BMA's resident doctors ballot for potential industrial action, and I want to speak to all of you as resident doctors directly before you decide how to cast your vote in that ballot. In the 10 months that have passed since I became the Health and Social Care Secretary, I've been really proud to work with you, with your reps, to improve pay and also to improve the conditions that you're working in as resident doctors. In opposition and in government, I heard a consistent message and continue to hear a consistent message from you that over more than a decade your pay was eroded, and that as the NHS slid into crisis, that meant that conditions that you were working in and frankly continue to work in are really difficult. I see that when I spend time on the front line talking to resident doctors and other frontline staff. I see it frankly in your reps like Ross and Mel, who meet with me often in their scrubs in the middle of a busy week of nights or a really stressful shift. So I know that at your stage in your career that you're worried both about the conditions that you work in today, how you're going to manage the bills, and crucially what your future in the NHS looks like, particularly when looking at things like bottlenecks for specialty places and progression to become the consultants of the future. I'm really committed to working with all of you on this, and it's worth just reflecting on the progress we've made in the 10 short months that I've been your Health and Social Care Secretary. Within 3 weeks of taking office, we resolved the dispute you had with the previous government and delivered a really good pay deal. Taken together with the pay rise we're awarding you as a result of the most recent pay recommendation from the independent pay review body, you'll have had a pay rise, an average pay rise over the last 3 years of 28.9%. Now, does that wipe the slate clean over more than a decade of pay erosion? No. But come on, by any estimation, that is a really good result. And as I've said to BMA reps in the past, sometimes you do need to know when to declare victory and to bank the win. I know there's more for us to do working together. I know there's more for us to do on pay. I know there's more for us to do on improving the sorts of conditions you're working in. And I know that critically, we've got to unblock those bottlenecks so that as well as improving pay and conditions today, you can also look to your future careers in the NHS with optimism and confidence, and the restoration of that promise that then junior doctors, now resident doctors, once had of being able to look forward to a bright future, a rewarding career, a lifetime of working in our NHS. So that's why I'm urging you to vote no in the ballot. Strike action, industrial action should always be a last resort. And frankly, I'd understand it if you had a health secretary with his fingers in the ears telling you were wrong, or slamming the door in your face and not making progress on pay and conditions. But in the last 10 months, as you've got to know me as your health secretary and got to know this government, you've seen a changed approach. We've made real progress on pay. We're making progress on conditions. And most importantly of all, perhaps, we're making progress in the NHS itself. I'm not going to pretend that the progress we've made in the last 10 months has been transformational and we've washed all the previous problems away. But finally, I think we can all see we're working in an improving NHS. There's lots done. There is so much more to do, and we can only do it together. And if we do, we can be the generation that will be able to look back genuinely saying that we took the NHS in the worst crisis in its history, got it back on its feet and made it fit for the future. Industrial action will set us all back. You, me, and most importantly of all, the NHS itself. So I hope you'll vote no. And I hope you know that I'm always here, and this government's always here to work with you and other NHS staff to deliver the NHS that we want to see back on its feet, fit for the future, valuing staff and treating patients on time with great quality care.